Welcome back to Vital Science. Namhlanje sikhuluma ngokuya esikhathini. Now, up to 7 million South African girls do not have access to or cannot afford to buy sanitary products. There is no national statistic on absenteeism due to the lack of sanitary products, but it is estimated that 30% of South African girls do not attend school whilst they're on their period due to a lack of sanitary products, in addition to factors such as pain and social stigmas. Let's have a look at an insert produced by Health E-News.
The name Minister of Menstruation came through a friend who really loved the work that I was doing. So he was like, you do so much work that you should be dubbed as the Minister of Menstruation. The way I explain period poverty to especially to non-menstruators is that I say, ask yourselves what you would do if you didn't have toilet paper. And period poverty goes beyond just not having the access to these sanitary products. It's also about, access to the infrastructure that we use when we are menstruating. So are we able to manage our period in a dignified manner without having it to be an obstacle?
We became aware as women that girls miss out on school because of periods. When I did my research, it was about thinking about how am I going to change the minds of our elders when it comes to something like inserting something into the vaginal canal, because we all know that we come from different cultures, and most of the cultures are if you insert anything into the vagina, then you break your virginity. So I was very aware that I was going to come across those kind of challenges. We go to visit impoverished communities where the women know their challenges when it comes to menstruation. They know the fact that yes, they can't afford it, it's expensive. I have to choose between a plate of food and a pack of pads. There are grandmothers looking after a whole lot of children because we have a whole generation of parents wiped out by HIV and AIDS. And the grants that these grandparents receive is not enough to feed the family and think about monthly costs when it comes to periods. So through education and talking about it and saying to them, virginity means having sex, and managing a period using a tampon or a menstrual cup has nothing to do with sex. It's got to do with managing your period. So it's all about just having the conversation. Our job as the Mina Foundation is to take over that role for those who find it difficult to talk about. So at least we know we're leaving the children with information that's valuable and true and correct.
Oftentimes people just hear things and then they go about thinking that it's true when actually it isn't, and this is where most of our period myths and taboos come from. It's like hearing fake news around our periods.
But those taboos didn't come from any religion. It comes from man-made taboos. We made it up. So we are the only ones that can destigmatize it, and the only way we can do it is by educating, talking, discussing, and finding the solutions together. You can't do it alone.
I hope people understand the significant impact that period poverty, period taboos, and stigma has on a menstruator when they don't have the necessary means in managing their period, but also don't have the access to the information.
After the break, we'll speak to Dr. Viju Thomas, a gynecologist and obstetrician, about the menstrual cycle. And of course, we'll get to hear from Tebogo Bosoga about her experience with abnormal bleeding. Stay with us. Welcome back to Vital Science. Tebogo Bosoga was diagnosed with lupus recently, and since then, her menstrual cycle has drastically changed as she now has to endure longer periods and at times experience large clots. She joins us to share her experience with us. Thank you so much for joining us, Tebogo, and it is lovely to have you on the show today. I think an important topic that we're having, but a lot of the time we don't consider it with the background of someone having a chronic condition. So before we get into your chronic condition, tell us about your journey with menstruation.
Thank you, Dr. Musa. Thank you for having me. I think I can say that before the lupus diagnosis, I had regular periods. I didn't have any issues at all. I had the normal issues that people will consider when you're having your periods, but things change after the lupus diagnosis.
Now, you mentioned that you had normal things, or the things that people normally experience with their periods. What are these things? And I think, with half the population being male and a lot of the time finding themselves ignoring this sort of discussion, it's important to bring them into it as well. So what are some of these things that, as women, you would term as normal?
Usually I will have cramps just a day before. I will have cravings, especially for chocolate. Sometimes I will just be extremely tired, but I now find with the lupus, the fatigue is getting worse. So I also have digestive issues, upset tummy. Sometimes I will struggle to sleep at night, headaches. So those were the normal things. The pain was bearable at the time before the diagnosis. The pain just changed after the diagnosis, few months after I was diagnosed with lupus.
Now, you got to a point where you were diagnosed, but of course you had symptoms that you were experiencing to get to a diagnosis of lupus. So what are some of the things that you were experiencing at that point in time?
With me, I started with the swelling, so my body just started swelling up. And I went to a GP, I was referred to a cardiologist. And when I got to the cardiologist, they found out it's not my heart, but they suspect it was my kidneys. So I was sent to see a nephrologist who did a kidney biopsy. And then it turns out I have lupus nephritis, which is, it basically means that the lupus then attacked my kidneys. That's how I then found out that I have lupus.
Now, this journey that you've been on that comes with getting this diagnosis of lupus, and then, of course, still being a woman and having to experience that, something changed that now, you feel like you're being compounded or your period got worse. Can you tell us how bad things got?
In the past 3 months, from the time I was diagnosed until August, I didn't really experience any major changes with my periods. But it changed when I was put on chemotherapy. So I had to do chemotherapy for lupus. And that's when I started noticing the changes. The first month, my periods were delayed. Then the second month, I had my periods twice in that same month. And then I started noticing that I have a lot of blood clots. The color of the blood also changed. It was a darker color. And I was sweating a lot. So I also thought maybe there's menopause also knocking at the door. And then with the sweating also came inconsistency in the flow, if I can put it that way. Because before that, I could predict that the second day will be my heaviest, right? But then after the diagnosis, instead of having my periods for 3 to 4 days, I'm now having them for 7 days. But the flow is not even heavier. I won't say it's heavier, it's lighter, but it takes longer. So I will sometimes go for a few hours without anything, and then boom, all of a sudden I'm on my periods again. That's why now it's more 7 to 8 days instead of the normal 3 days that I was used to.
Now,
those were the changes.
What explanation were you given for you having these new changes, even though you'd had periods before in your life where the only new thing was this diagnosis of lupus? What explanation were you given for you having this change in menstruation?
So when I started experiencing, because I also experienced excruciating pain, the pain radiates to my legs and to my back, especially my lower back. So the first time it happened was the beginning of December last year. So I went to the doctor and she did some tests, and then the ESR was high. So my ESR was at 112. So she explained that it's inflammation and it's probably also an infection. But then I wasn't put on antibiotics because of also I'm already on a number of things that I need to take, the medication that I'm on. So she just monitored to see whether I don't have a kidney infection. And from there, so I was just given painkillers. So last month when it happened, I think because it was a time I was very busy at home as well, it was during Christmas time, I didn't pick up that I was in pain and I'm experiencing all of these things because I was already on painkillers. So when it happened last week, Friday, that's when I thought that I actually need to get to the doctor, get an assessment, and find out. So I'm seeing my nephrologist today, and it's one of the things that I discuss with him to see whether maybe I have endometriosis or it's something else, or is it related to lupus, or is it the medication? Because I think sometimes medication is the one that actually changes your flow, or it changes how you just respond when you're having your periods.
Well, thank you so much for sharing your journey with us. I think it's been quite informative, especially when you look at things in the whole perspective, where someone has the everyday or the usual menstruation or menstrual cycles that everyone would discuss, and then you add a chronic condition on top of that, and just being able to notice and spot that some things are different and that you'll be able to go out and get the assistance that you need. Because some things just shouldn't be the way that they are. And it's important to have these discussions so you can actually recognize at home that, hey, maybe that's not the way things are supposed to go. Well, that was Debucho, and of course she was sharing her story with us, and thank you to her. It's time for us now to chat to Dr. Thomas, and he's going to tell us a little bit more about the menstrual cycle. A menstrual cycle begins when you get your period or when you menstruate. Now, this is when you shed the inner lining of your uterus. The cycle is part of your reproductive system and prepares your body for possible pregnancy. To give us a sense of what a menstrual cycle is, how long it should go for, how long it should last, and of course, how to best prepare for your cycle, we are joined by Dr. Viju Thomas, a gynecologist and obstetrician at Tygerburg Hospital. Thank you so much for joining us, Doc.
Thank you very much, Mr. Thanks for having me.
So half the population does not necessarily understand what periods are, and the other half of the population experience this at least once a month. So very basically, or in a very basic manner, explain what a period is and how that comes about.
So a period is a very natural phenomenon where the woman prepares for pregnancy. So in essence, what happens is we have hormonal changes that take place. And those hormonal changes are necessary to sort of effect a change in the uterus. And these effects are roughly to increase the amount of endometrial tissue within the uterus, which is the lining inside the uterus. And the uterus is the organ that I suppose we can say will harbor a baby or will carry a baby throughout the pregnancy. So what in essence happens is that the uterus and the body is preparing for pregnancy, and if pregnancy doesn't happen, then hormone levels start to decrease, and that will be a message that goes to the uterus to say, all right, this month was not successful, or the cycle itself was not successful, and the uterus will then shed the lining of the uterus through the cervix and through the vagina. And then we will start with a new preparation the following month for possibly the next pregnancy, if that is the desired effect by the woman.
Now, you mentioned that, there are all these complicated processes that happen in the background, but it seems like such an unsure time for a lot of people where we can't pinpoint exactly when your period is going to come. So what age should people or parents or guardians be on the lookout for when periods should start and when they should end?
It's a very good question, and I think it's a question that it's an answer that should go out into the public. So I'm glad you asked it. It really depends on the first factor is what we call secondary sexual characteristics, which are also hormonally driven, and this is things like hair growth. I'm talking about underneath the armpits and pubic hair, for example. Breast growth. If those things are happening by the age of about, let's say, 16, and that has happened up to the age of 16, then that's okay. But if at the age of 16 that young girl has not had a period, then that needs evaluation. If, on the other hand, secondary sexual characteristics have not developed by the age of about 40, then that's something that needs to be evaluated at an earlier age, because that could be an indication of something that is a problem with the endocrine system. That's the hormonal system that the body utilizes for different functions.
Is there such a thing as too early to have your period or start menstruating? So for an example, a parent has got a 9-year-old that's starting to develop very soft under armpit hair, and then the period could start at 9. Is this something we should be concerned about?
In some cases, yes, there could be an abnormality where we might want to look at abnormal hormones that could be causing, or let's say abnormal hormone production, whether it be from within the body or from outside the body. I would say that typically we'll expect a period roughly at around the age of 12 plus. So if it's prior to that, it does need evaluation.
Now, what do we tell a young woman? So either someone that's, towards the end of their primary schooling or, before the age of 16 about their periods. What should they expect to have and find in terms of the changes that will happen?
Would you please repeat that question, Mr. Broke up a little bit there.
No worries, I'll repeat it. So what I'm saying is, what should we expect? What do we tell people that are about to start their period about what to expect in terms of the body changes when their period is about to start?
That's an excellent question. There's two parts to this. There's the social part of it, where we hope that this young girl has got support to sort of guide her through it. Typically, a woman who's older than her who has been through this will be able to sort of give that emotional support, because this is something that can be quite daunting if it's not expected. I think young girls should be told at quite a young age, like as soon as their sexual character starts to develop, that this is something to expect, and it is a very natural event, and it's not something to be afraid of. What we don't want is to have information coming from hearsay, from friends and that sort of thing, which could possibly be misleading to that young girl. So I think education from sort of healthcare providers, definitely schools, possibly within the life orientation program, should be able to put this through. And what they should be able to expect is obviously the bleeding that she's going to experience, but also possibly to explain that prior to this, she could possibly experience premenstrual symptoms, which could also be normal, and maybe sort of guide her through that and sort of give symptomatic treatment should it be necessary. But mostly I think it's information at school and also support for this young girl.
Now, you've mentioned premenstrual symptoms. What should we expect there? So
premenstrual symptoms can vary quite widely. They can be very normal. Some girls do experience very little symptoms. Some girls experience severe symptoms. And this could be a sort of change in mood, possibly even a little bit of depression, and let's call it also an aura of pain, even for that matter, and due to the hormonal changes that are taking place in the body.
Now, a lot of the time people will treat menstruation as being something that's quite subjective, where, someone will describe their pain and say, well, the worst day for me is day 2, and then everything kind of settles down thereafter. But someone could be in severe pain even on day 1 of their period or day 5 of their period. So how do we gauge when something is abnormal with respect to the amount of blood that's coming out, but also the amount of pain?
So this is an excellent question. Let's start off with the amount of blood. The normal amount of bleeding has been described to be roughly 3 tablespoons of blood, and this is not often the case, but this comes from studies that have actually objectively looked at the amount of blood that has been shed during a menstrual cycle. And it shouldn't really be more than 80 mils, which is not a lot of blood. So to put that into perspective, I think if a woman is changing a pad or a tampon, for example, every hour, every 2, and she's finding clots, that's not a normal sign. Clots certainly are not a normal sign. So with the amount of bleeding, I think it really should not be a lot of bleeding, and there shouldn't be clots. I think let's start off with that to be able to put information on. The second thing is the amount of pain. So I specialize in endometriosis models. So we have this problem where we find the normalization of pain. The concept of normalization of pain is very much due to the patient not really having a barometer or a reference point to what normal pain is. And for them, it'll be, well, this is what the pain is, it must be normal. And that's something that's sort of something she begins to accept until such time that she starts to realize, hold on, this is just a bit too much and I'm not coping with it. So I think with regards to pain, if I were to sort of give some sort of guidance with regards to pain, the pain can start normally roughly, let's say, a day to two before your period starts. And that should be sort of slight, low cramps kind of a sensation. The sort of apex or the peak of the pain can vary. And it certainly shouldn't last for more than the duration of the period. If, however, the pain is there more than 2 days prior to the period, then that's what we call secondary dysmenorrhea, and there is something wrong there. If the pain persists after the periods have stopped, then that's also an indication that something is wrong and definitely needs to be investigated. The causes of pain during a normal period are usually just due to a release of prostaglandins, and that can usually be managed with normal anti-inflammatories. And I mean, to be fair, I think people don't like to take pain medication, but in some cases it's needed. And if it's managed with a simple anti-inflammatory, then that's not something to be too concerned about. If it's not managed with something, simple anti-inflammatory and more medications required over a period of time, and that definitely needs to be looked at. So I think the awareness of normalization of pain is something that we should be we should try and get out into the public to be able to say, look, pain isn't normal, and if it's not responding to some simple analgesia, then you need to have it looked at.
Now, we've spoken about menstruation throughout this process, but of course it falls within the menstrual cycle. So take us through what a normal menstrual cycle would look like in terms of days for people.
Okay, so the typical menstrual cycle is about 28 days. And we normally count, and that's an average. It can vary from about 24 days to about 38 days. So there's a range, but we normally say about 28 days. And it's counted from the day the patient first bleeds up to the next time she has her first bleed. So that's how you count the cycle. Within this, you would have the bleeding period, which we can put on average, let's say about 3 to 7 days. And thereafter, the bleeding should stop. We should not expect bleeding between your periods. That's not normal. That's an indication that something is wrong and this needs to be evaluated. You should only expect your period at the next period. Certainly also, we don't want periods to come before 24 days, and we don't want periods to come after 35 days. If a period comes after 35 days, there could be a problem with ovulation, and that also needs to be evaluated. So that's in terms of duration. Then the next phase comes what we call ovulation. And ovulation is where the egg gets released from the ovary in preparation for fertilization. And for people who are trying to fall pregnant, this can vary. And there are many apps and tests that you can utilize to try and predict that day of ovulation. Typically, you would want to count that not from the first day, but you want to count it from the last day of your period. So you have to have an idea of what your cycle is like and then work backwards, and usually looking at about day 16 prior to that. So now within that period where ovulation takes place, you've got a window where fertilization can take place. And we know that sperm can be present and viable for about 3 to 5 days after sexual intercourse. And if fertilization takes place and the embryo implants, then that patient will become pregnant. If that patient does not fall pregnant, then what will happen is that the hormone levels will fall, and then thereafter she will expect a period, which will be the first day of the next period.
Well, thank you for that explanation. I think it gives a nice roundabout idea of what people need to expect. And of course, we're going to continue our conversation with Dr. Thomas. And of course, we're looking at the menstrual cycle. After the break, we'll speak to Sharis Speikerman, a project coordinator at Project Dignity, about period poverty and of course, the stigma surrounding periods. Stay with us.
Boleka imali ukuthi ngikhona ukubathengela then inyanga mayiphela ngale mali yegrant bese ngiyathatha ngibuyisela back siphila njalo futhi kani ngisiza umama nayo uyakhipha imali makahola inkamkham abathengele labantwana ukuthi kwazi ukuthi kube nama-pets
inhliziyo yami kabuhlungu akusebenzeki manje nama-pets ya akunanto ezokhona ukuyenza maybe kumele ufake ithawula or something ingenza ngizizwe kabi because angikho ukuhlala nabantu and abanye abantu bayangihleka ngoba ngifake indwangu.
Many women menstruate monthly for an average of 40 years of their lives. In many countries like South Africa, women do not have access to sanitary products that they need every month. Period poverty in South Africa affects girls and women by preventing them from working and going to school. And this creates a stigma surrounding periods and has a negative effect on their overall hygiene and can also force girls to use unhygienic materials such as cow dung, leaves, newspapers, and dirty cloths. However, several organizations such as Project Dignity are working to combat each of these components, of course, of period poverty. Speaking to us about period poverty, we're joined by Sharis Speikerman, who is a project coordinator at Project Dignity. Thank you so much for joining us today. Let's start off by defining what period poverty is.
Period poverty is when girls can't go to school or go to work due to their periods, so they tend to stay at home. They can't afford basic sanitation.
So can you explain how you would go about assisting them with respect to making sure that there is dignity back in having their menstrual periods or cycles?
Sure. So we make a washable, reusable sanitary pad that can last from 3 to 5 years, depending on how they use them and their flow. And we go into schools and we educate the girls on period and menstruation, and we hand out the products, show them how to take care of them. And then we also give them a motivational talk to make themselves more dignified and feel better about themselves.
Now, what goes into a program like this? I think earlier on we were listening to the Minister of Menstruation, and she was giving sort of an all-round idea of what goes into a period. That it's not just the act in itself where, you know, there is shedding of the endometrium and then it comes out and that's the end of it. That there's so much psychology that goes into it. So from your perspective, what went out to make sure that you give the dignity back to women and young girls?
So we try to make them know that, try and let them know that it's a natural thing and that it happens to every girl. We give them the pads to make sure that they don't feel ashamed. It's very sad they wear, like you say, cloths and multiple different things that aren't sanitary. So we try and just give them back their dignity, show them that it is their life and they can take charge of their lives.
Now, on the ground, I'm sure, you know, you get to see what it actually looks like when you can conceptualize a concept in a boardroom and say, you know what, this is what we want to teach people. But when you get on the ground, you realize that there's a lack, for instance, with some pockets of knowledge around things such as menstruation. So what experience have you had when you get to these grassroots levels and you try, you know, impart this knowledge about menstruation and try get something back out of that?
Yeah, it's quite sad. Girls generally don't know what's happening with themselves, what's happening like with their bodies, why they're changing. So we just try and give them education and let them know what is happening to them. yeah, I hope that answers your question.
What have you identified as one of the biggest contributors to the lack of basic knowledge about menstruation and the menstrual cycle and periods and, just having the dignity of a normal day-to-day period?
It's very difficult because girls struggle. A lot of girls we see are from child-headed homes, so they don't have parents, they don't have people to talk to about periods. So it's very difficult. Schools do try and talk to them about periods, but it's, as you say, there's a stigma around it. Girls don't want to listen to it. People talk about it. So when we go and we try and educate them and give them a safe space to speak and ask questions, because we're all girls, we all go through it. So it's very difficult with girls that are in child-headed homes, come from far communities, and they don't have anyone to look up to.
Now, education naturally goes beyond just trying to educate the girls that you'd be seeing at the time, because there are tons more, for instance, that you can't potentially get to. So in terms of a broader perspective from your side, what are you looking to achieve with respect to engaging and educating a wider audience?
Well, yeah, sometimes we do try and speak to the boys as well and try and get people, all the learners at the school, to know what is happening in periods, because a lot of the boys also, with the stigma around it, they don't know what's happening, and so we need to try and educate everyone and let them all know that it is a natural thing. All girls go through it, and try and break the stigma.
How do we address the stigma? I think it's a point that you've naturally highlighted quite a few times, but I think a lot of the time people get lost in words such as stigma. So can you explain what that would be and how you'd address it to make sure that that no longer continues?
I think it's just all about education and awareness, people knowing about periods and knowing that it's natural, but it's very difficult because a lot of times it's lost. We try and get out on social media and try and make it well known and aware, make people aware of this issue, but a lot of people don't have access to it, so they're not aware. So it's something that needs to be addressed, that everyone can be educated about it.
Now, you're naturally on a mission to end period poverty. What does that look like? In practical terms, how could we get to a point where we say we've ended period poverty?
Well, no period poverty means that all women and girls do have access to period sanitation products, whether it's tampons, pads, no matter. But every girl having access to it on a monthly basis, because it happens monthly. And
lastly, in terms of products or, items that can be used. Now, I think you've highlighted this in, what you do as a project, that you do go out to these communities that wouldn't necessarily have all these sort of things available on a monthly basis. So in terms of educating them about what they can use, for instance, when the month comes around and you don't have enough money for for pads and things such as that, what do you say they can use?
Well, it's very difficult. We don't go in to tell them what else to use. We go there to donate these pads to girls, because it's very difficult to get access to like cloths and things. When they're at school, all these things fall out. So we've made a product that will help them go to school, make sure that it has all the proper sanitation and no gels or anything. I haven't really had that question before, to be honest.
Well, thank you so much for joining us. I think what you have given us has been quite informative and speaks to this idea that we need to continually look at what we're doing, not just these faraway communities that we imagine in boardrooms, but look around our own communities, because there could be so many people that experience this period poverty. Of course, that was Cherie Spakerman, a project coordinator at Project Dignity. We're going for a quick ad break right now. When we come back, we'll wrap up our discussion with Dr. Thomas around your menstrual cycle.